Hello, hello. My name is Jones, and today we are going to look at the post-operative nursing care. In previous lesson, we looked at the pre-operative care, and then the first lesson within this series, we looked at the introduction to surgery. Okay, so now we are looking at post-operative nursing care. Okay, so the aim of post-operative care is to prevent infection. The aim of post-operative care is to prevent complications. Okay, so those are the main aims of post-operative care. Okay, you can put aims according to the condition that you are looking at, but those are the aims that we can just come in as a general aim. Remember, the patient might be in pain, so you can say to alleviate pain. Okay, as we have already established, we have some general aims, so you can look at the principles and necessarily turn those into the aims of your post-operative care. Okay, so after you talk about your aims in your post-operative care, the best framework as proposed by Mr. Jones is POWER. Okay, POWER post-op. Okay, so POWER is a framework that has been proposed more of a mnemonic. So in POWER, there is pain management. Every patient that comes from theater will experience some pain because of the wound that has been made because of the surgical operation. P, again, is for prevention of infection. Okay, due to lost skin integrity, the patient becomes at risk of having infection. So you have to ensure that you prevent infection. And remember, this person is in the hospital setup, so they are also prone to nosocomial infection. P is for psychological care. Okay, so psychological care is quite important post-operatively because of the changes that will happen because of the surgery that has happened. So psychological care is important in order to reassure the patient that everything is part of the recovery process. Okay, some surgery may require certain modification with position, so position also becomes very, very important to do with P in the POWER framework. Okay, so you can talk about P to do with position. Remember, recovery position is the first position that the patient will take after undergoing major surgery to promote recovery. Patients who have had some chest surgery might need a semi-fowler position to promote maximum lung expansion and prevent atelectasis or prevent hypostatic pneumonia. So you can have the one letter P that is representing all these things. Then O is simply for observations. Remember, observation of temperature, pulse, and respiration, and then special observation to do with the fluids that have been administered, urine output, and the others here becomes very important post-operatively. W is for wound care. There is a wound or incision that was made, okay, during operation, and you have to ensure that you use the appropriate cleaning materials so that you prevent infection. E is for exercises. Early exercises promote healing. Early exercises prevent adhesion. Okay, especially for general and patient who went under general anesthesia and had abdominal surgery. So early ambulation is very, very important, and it reduces all the other stresses that come after surgery. Okay, so R, we can talk of rest. Okay, rest and exercises. Rest helps the immune system to respond well to infection. Rest helps the reconstitution of the immune system, whilst exercises improves function of a part that has been operated on. So exercises helps improve immunity and the body's response to pathogenic organisms. So Within this, we might not follow this framework, but you see that the elements that are in this power framework is what is reflected. Okay, so as much as we talk about power, the issue of EMS will come in. Okay, so EMS, like I have already indicated, then E, there's collecting of a patient from theater, okay, or from attending the patient from the theater. Okay, so when you take the patient from theater, you have to ensure that the ABCs are okay, that is the airway, breathing, and circulation is okay. And as you go to collect the patient, you can carry a vomitous ball as some anesthesia, okay, affects patient's vomiting center, leading to nausea. Okay, and then you can carry the vomitous ball as I have indicated, and then you can also carry an anesthetic tray just in case the patient vomits or the tongue falls back. So you can carry the anesthetic tray. So these two things, vomitous ball and anesthetic tray, are very, very important. Okay, so it's important you remember that there is collection of the patient from theater, and most of the time in our nursing care we forget to indicate this and the importance of proper collection of our patient from theater. Of course, because of the changes that have happened, where the theater crew are the ones that are bringing the patient to the wards, then other institutions, you find that when the procedure has been done, actually the theater crew calls you to go and collect the patient. So it's important that you know, and you cannot just look at that as the job of the theater nurse. Okay, so the theater nurse job ends within the intraoperative phase. So from after the theater, then patients should be collected by the ward nurses so that they can continue caring for the patient. So we can talk about room and rest here to do with environment. Patient will be admitted in the post-operative bay with the necessary equipment such as drip stand for hanging fluids, oxygen cylinder, okay, for administration of oxygen, and then suction machine for removal of excess secretions, and post-anesthetic tray here that will help. From there we can try to help patient with avoid the tongue falling back. Okay, so items that are found within the post-anesthetic tray there will help us in stabilizing the patient. The bed should be post-operative bed, okay, and that is the bed in which you receive the patient. So post-operative bed should be made when you take the patient to theater, okay, that is in the final arrangement, okay, that's the final phase of the pre-op. So this bed is now has to receive the patient. Okay, so post-operative bed has a board under the mattress in order to help the bed to be like stable, not to sag and the likes. And you have to ensure that the room in which you bring the patient is well lit for easy observation. It should be warm enough, average 24 degrees, to prevent hypothermia. Okay, and then it should be well ventilated in order to reduce infection. Good ventilation helps bad air or air that has been polluted to easily come out of the room. So it should be well ventilated room. The room should also be quiet, because quietness is going to promote rest. Okay, and it will help you to achieve that. So we can reduce radio and TV volume. Okay, and then all squeaky trolleys out there. So observation, as earlier indicated, is for the vital signs: temperature, pulse, respiration, and blood pressure. So these, the way they are done is quarter hour in the first hour, in the second hour half hourly, in the third hour hourly, and then you can revert to maybe BD depending on the surgeon's preference for that word. Okay, because mostly these patients may not learn some abnormal temperature. So you can even do twice a day. It can help. Observe for vomiting, as the patient is prone to vomiting as the after effects, so a side effect of anesthesia. You can observe for bleeding from the incision site. So this is what we call primary hemorrhage, okay? It may come as a complication due to poor surgical technique. So observe the incision site within 24 hours for any signs of bleeding. Observe for pallor, okay, that is inadequate oxygen within the tissue, okay, or perfusion of oxygen within the tissue. So you observe for cyanosis. And then pallor, the pallor can be seen because of reduced blood volume. Observe specific things that are related to the condition or type of surgery that the patient has done is what I can necessarily say about observation, instead of just talking about temperature, pulse, and respiration. The nutrition, initially, patient might be new already depending on the type of surgery that was done, okay, and also the type of anesthesia that was used. So if the patient was new already, for let's say for instance in the first 24 hours after surgery, it will be followed by sips of water on the second day, then third day, depending on the type of surgery, patient may revert to light diet and then afterwards normal diet. So fluid diet, when bowel movements resume, okay, is what is recommended. Okay, is what is recommended post-operatively. Okay, of course, in that sequence of fashion. All right, so then for diet, you are going to talk about carbohydrates for energy, protein for worn out tissues, and vitamins. Okay, especially talking about vitamin A and C to improve the immunity. You can serve food when the patient now is eating normally in a small quantity and serve it attractively. This promotes appetite. Okay, so remember always that the type of surgery matters on the post-op orders that follow. In the power framework, we talked about wound care. So in wound care, there is daily cleaning and dressing of the wound, okay, with prescribed antiseptic solution. Okay, so at the incision sites, most of the time, it is preferred that you use a spirit, okay, that is at the incision site. Okay, so you can use spirits, normal saline, okay, Savron or Hibitane for clean wounds, and then jig can be used for infected wounds. Okay, to do with wound care, there is care of drainage tubes. If at all there are some tubes that remain, so you have to clean and shorten them until they are removed. Okay, and this is done usually on the fourth day. That's when they are going to remove the drainage tube. Okay, so we can talk about the drugs also that the patient needs to receive. So patient is likely to be on some analgesia. Remember the triple A there, analgesia, antibiotic, and some supportive drugs that you can give. So administer prescribed medication or antibiotics for prophylaxis, preventing of infection. Okay, and then you can also administer fluids to maintain good circulatory volume, as patient may have lost some fluid during procedure. Okay, we mentioned about pain relief in the power framework. So pethidine is given PRN, okay, especially within the 24 hours post-surgery. Then after that, you can give diclofenac 3 times a day. Then after that, maybe Panadol and the likes. But it's important that you respect that in pain relief, there is pharmacological aspect in relieving pain, and then there is psychological aspect. Psychological aspect, that is where diversion therapy comes in. Okay, give patient a magazine to read, patient watching TV. All these techniques helps to relieve pain. Okay, then in power, of course, we can still talk about hygiene. Okay, remember prevention of infection. In postoperatively, we are talking about all hygiene measures. So hygiene includes bathing of the patient, oral care, hair care, nail care, and also changing of linen. Okay, whenever soiled, linen needs to be changed. Then psychological care. Here you explain the condition to the patient, explain the disease process, reassure the patient, and involve the patient's family members so that they can gain strength from the stress that is related to the surgery. Okay, exercises. Mostly it might be passive exercises, and these exercises that are done with the help of a nurse. Okay, this is to help prevent complications, and complications are like ankylosis or stiffening of the joints or deep vein thrombosis. So when you do exercises, you promote blood circulation. So it's important that you do exercises or help patients do exercises. Active exercises such as deep breathing also prevent hypostatic pneumonia. Okay, extension and flexion of limbs prevent also deep vein thrombosis. Okay, so patients should be encouraged to walk around. Of course, this will also prevent deep vein thrombosis. Okay, so you should note that if let's say pre-operative patient had a cough, surgery would not be recommended. But in case the patient has a cough, they should support the part that has been operated to prevent wound problems that may come, wound complication like wound dehiscence. Then E is elimination. You monitor fluid intake and output and balance within 24 hours. Then monitor the urine output. Okay, urine output here, you have to look at the color and the amount in order to rule out other conditions. You have to monitor bowel movements. Okay, there is a risk of a complication known as paralytic ileus. So ensure that you rule out constipation, okay, or diarrhea that the patient may have. Remember, E we said is for exercise in power, so E can also be for education of the patient. So advise the patients, okay, about their condition and how they can prevent a recurrence. Okay, so that is what you can do post-operatively. Okay, so we have looked at post-operative care, and the post-operative care, we have summarized it in the Jones model, that is the POWER model. POWER model helps you to come up with a framework of care of the patient. Okay, then in surgery, we have general complications. Okay, so specific complications, we can talk about them if we have a condition that we are looking at. So in the general complication, we can use the K-WASP. Okay, the K-WASP, that is K, letter K, is a mnemonic. So K-WASP, that is the K, letter K, then W, the H, A, S, P. Okay, this is the mnemonic for remembering the general complications that are seen. Okay, so W in the K-WASP is for wound infection. So there is a difference when we talk about wound infection and then wound separation, or wound related complication to do with wound separation. So there is wound infection, there is wound separation. Okay, then there is a shock as a condition that may be seen. There is hemorrhage. There is systemic infection that can be seen. Keloids can develop from the equipment where they were used there. If they were not thoroughly clean, they have last and the like, may lead to formation of keloids. And then hypertrophic of the scar here, or hypertrophy of the scar, can also be considered as a complication because it may lead to limits of movement. Okay, then There can be complications that may arise from anesthesia, and also we can talk about hypostatic pneumonia or aspiratory pneumonia as some of the complications that are seen. So this one is just understood within the KWASIP mnemonic. So when you say wound infection, the first sign of wound infection is increased pain in the incision. Okay, the incision shows signs of infection by becoming reddened, warm, and sodden, and by draining pus like material, then you can confirm that here now there's infection and the pus would have formed because of bacterial activity. If a patient develops a wound infection, it is important to prevent it from spreading to other patients within the wards and also other area within the patient. So there's wound infection. Okay, so wound infection can be primary or secondary. Primary, that is arising within the short period after infection, or then secondary after 2 weeks. So within the first few days after, it can be primary infection that were there before surgery. Then secondary infection that are coming 2 weeks after surgery, post-surgery. Then those are secondary infection. Primary infection may come because of poor surgical technique and also equipments that were used if they were not very, very sterile. So it may lead to that. Secondary infection may come because of reduced immunity and the other reasons necessarily that may come. That may come in, or that may come in to bring about these complications. Okay, then the other complication is wound separation. This is the breaking apart of the edges of the incision. The cause of wound separation are malnutrition. Okay, malnutrition interferes with the body's normal healing process and immunity. So defective suturing, infection, and excessive strain on the wound from stretching, coughing may lead to wound separation. So in wound separation, we have wound dehiscence and wound evisceration. So these are two types of wound separation that can be seen. So when I say dehiscence, it is the separation or opening of the wound edges without protrusion of organs. That is wound dehiscence. The separation of wound edges without protrusion over the internal organs. Okay, so small openings are most unusual and may be closed or supported with a sterile tape. The opening always needs to be supported and the wound observed regularly for further opening. Okay, so dehiscence, the organs do not protrude, but we see some opening on the suture line. Now, when you say evisceration, visceration, so here there is separation of the wound edges with the protrusion of organ, of a visceral organ, evisceration. So there is a protrusion of the visceral organ. So this is the separation of the wound edges with the protrusion of the organ. This rarely happens, but it is a serious complication when it does happen. The patient is usually taken to surgery immediately for resuturing. Okay, so I hope you understand the difference that is between dehiscence and evisceration. Okay, then other complications include shock, hypovolemic shock that can be seen. Okay, anaphylactic shock due to allergies to anesthesia that can be seen. Hemorrhage, that is excessive loss of blood because maybe patient has the disseminated intracoagulation, and disseminated intracoagulation is also a complication that may result. So a breathing disorder. So patient might have had that problem, or because of reduced platelet count, patient may experience severe bleeding, which we are calling hemorrhage. Okay, apart from, let's say, talking about just wound infection, some infection can be systemically be introduced. So systemic infections are also seen, okay, post-operatively. Keloids, okay, because of from the instrument, especially if they have got lust, you might find that the patient may develop keloids, okay, in the edges that that were cut, keloids may develop. Then the hypertrophic scars. Here, after suturing, especially for big wounds, major surgery, you see sometimes abnormal scar formation. Okay, here we have hypertrophic scar formation. So that becomes a complication, okay, or a complication that can be seen. Okay, and we have already talked about complication arising from anesthesia, but we can also talk about hypostatic pneumonia and aspiration pneumonia, okay, as some of the complications that are seen. So WASIP-K, okay, is a mnemonic that can be used to remember general complications that come with surgery. Wound infection, okay, hemorrhage, okay, anaphylactic shock, okay, then S for shock, or P for P, we can look at it in terms of other complications like pneumonia, which is hypostatic pneumonia, okay, in the P, and then K for keloids that can be seen. Okay, so within this WASIP, you can know, because a WASIP is, we're looking at a WASIP as one of those common insects that we see around. So we can remember the common complications of surgery. Okay, so post-op, please, is power. Post-op is power. Post-op in power, it is a framework of pain management, prevention of infection, okay, psychological care, position, okay. Those are some of the things that P can represent. O for observation, W for wound care, E for exercises, E for environment, R for rest, okay. Rest becomes very important to talk of it, but you follow the issue of aims, okay, as you are writing your nursing care to do with post-op care. So post-operative phase is the last phase of peri-operative period, okay, or peri-operative care. Perioperative care, which we started looking at, is the care of the patient in pre-op, intraoperatively, and also post-operatively. So that is what we were looking at in post-operative care. Okay, so this marks the end of our introduction in part 1, 2, and 3 of our introduction to surgery. Okay, so I'll urge you to look at them as many definitions on how these words come about in surgeries, those that are common in surgery. Once you know how most of these words come about, they will not sound to be gibberish. Okay, you'll be able to figure out the meaning of most of those words. So we looked at some definition of terms, okay, or terminologies that are used in surgery. Of course, this was to just simplify some words that you are likely to see. In our discussion, it has not been exhaustive, but we tried by all means to record our lesson within a short period of time so that we can bring out the cream. So from me, I'm saying thank you and keep studying.